Thanks, Susan. And thanks everyone for joining. So today we have Professor Raj Padwal from University of Alberta giving us a very interesting talk on why we should consider commercialization work. I'm quite intrigued actually by the title. So he is director of the University of Alberta Hypertension and Dyslipidemia Clinic. He's a full professor. He's an internist at the University of Alberta. He is CEO of Millimeters Mercury Incorporated, that's a clever name, which focuses on creating sustainable, scalable software platform solutions that enable best practices. He's well funded and well published, over 270 peer-reviewed papers. Impressive. He's received funding from various agencies, including CIHR, and he was the past chair of, or is the past chair of the Canadian Hypertension Education Program Guidelines and a member of the National and International Blood Pressure Guideline Committees. So with that, I will hand the mic over. Take it away, Raj.
Thank you, Ben. Well, hello, everyone. Appreciate the opportunity to present to you today. I thought when Kabiri asked me to talk about the company, I was a little taken off guard. First of all, I haven't had an academic invitation to talk about the commercialization work that I do. Most of the time in Canada, it seems like it's something that should be kept more of a secret. People have more likely a negative reaction than a positive reaction to commercialization work. But I will say in other places in the world, commercialization goes hand in hand with academia. And so I've really learned that over the last few years that I've been at it. And so when the invitation came, it took me a little bit to decide to say yes, because I wasn't really sure what to talk about. Certainly I can give you some of my story, which is what I'm planning to do. And by the way, I can't talk about myself for an hour, so this is probably going to finish fairly reasonably quickly. But then I thought, you know what? I've had such an interesting time and really fun time. It's not without its challenges for sure, that I decided, I want others to learn about it and understand what's possible. Because I do think, as someone who never thought he would start a company and be in the commercialization entrepreneurial space, I do think that academics are ideally suited to commercialization work. There's some aspects that make us really, really good at it. And then there's some other aspects which you have to stay abreast of or on top of, because they are a little bit counterproductive to success in commercialization. So anyway, let me get started here. The objectives. So the objectives today. Really, I want to impress upon you why you should consider commercialization work. And if you get nothing else out of this talk, I would submit to you that commercialization work is just another way to fulfill your academic mandate. In fact, I think in some ways, it's a more enjoyable and an easier and more controllable way to get, in the end, at the objective that you actually are trying to get at from the academic angle. So I'll go over that with some examples in my career. And then talk a little bit about why academics are suited and why we're not. And then if you are interested, in case I pique your interest, I'll give you the steps involved. And I wish someone had sat down and explained those to me when I started, because man, I had a lot of difficult lessons until I really learned how things work and what I should be doing. So the disclosure here is kind of obvious. I am the CEO of this company, Millimeters Mercury, which actually started out as a blood pressure device company, hence the name, but then morphed into a digital health platform as a service provider. And I'll go into a little bit of that story in a few slides. So you heard a little bit about my background, but I think it is important for you to understand where I came from. I would say I'm a typical academic internist at a, typical university in this country. Typical practice, mix of clinical and academic. Trained in Saskatchewan, Edmonton, Calgary, Toronto, and I've been in practice for about 20 years. And I do a mix of inpatient work as well as my cardiovascular risk reduction, increasingly focusing on the latter, and really hypertension and dyslipidemia are my major focuses. As mentioned, I used to do guideline work. I spent a lot of time in that arena, and that's how I met Kabiri. And we worked together along with many others on the hypertension guidelines in Canada. And really, I think I can summarize my academic career by saying that I've pretty much done a little bit of everything. So maybe that speaks to my, I don't know, restlessness and why I picked general internal, the fact that I like to do different things from every couple years to every couple years. I'm not really someone who is satisfied or gets a lot out of just doing the same thing and being a super specialist in that. I know there are advantages to that, but it's just not really my nature. So I think that this does speak, though, to a sort of a broad training set and a broad experience in methodology and different kinds of academic work. And then you can see some of my work at the bottom. So, really, I think if I look back on my career, I did pretty well on the publishing and the funding side. Um, but there was always something missing in terms of impact. And when I started off, I was really focusing, especially in obesity pharmacotherapy, which was not a great area to be in. It is now. So I guess I shouldn't have left. But at the time, there wasn't a huge amount going on. Most of it was focused on surgery. And then the hypertension stuff, that was very fulfilling, guidelines and helping improve control rates. But there was still, it still was difficult. I couldn't really look myself in the mirror and say, you've had really big impact in the ways you've wanted to on the health of people with hypertension or obesity or dyslipidemia. So I started thinking about other things to do. Now, I just want to say, I'm assuming I'm talking to an audience of academics, and we all love academia for various reasons, but I think the biggest one is just the passion, right? The passion for innovation, the curiosity, just the potential to create something, new knowledge, and have that disseminated and have that impact the lives ultimately of the patients that we treat, perhaps the students that we teach. And so really that's what drew me into academia. And that's what kept me going for the last sort of 15 to 18 years. But my interest has been waning. And that's really why I started to look elsewhere. What made me lose interest? I had to revise this slide a few times because I didn't want to be overly critical. But I think some of you probably can relate to some of the points on this slide. Look, you spend 2 months, so I would say maybe 100 to 200 hours, depending on the stage of your career, putting together a CIHR grant. And And at the beginning, it's a lot of work because you don't have that foundational boilerplate. You have to build it. Later in your career, you can reuse some of the stuff in the background, etc. You've written papers and reviews, and so it becomes a little bit easier. But at the end of the day, you're toiling away with your colleagues to pull together something. And at least in my institution, it really almost felt like a burden after a while, because of the bureaucracy, research services, human resources. You ultimately, even when you spent all that time to get the money, then it felt like there was a bureaucracy in front of you protecting you from spending the money. And I don't want to be overcritical or cynical, but that's really how I felt, sitting in meetings or interviews where I was told I couldn't hire the person I wanted to hire because someone else was more suitable for the job. So I don't know how things work in Montreal. Maybe it's a lot different, but this bureaucracy after a while really started to wear on me. And the fact that you would get the money and it felt like a burden to try to then hire and spend the money, that was something that was starting to make me frustrated. Now, the other thing is, I would say to you, I don't know how many of you knew Me Too. He was a mentor of mine, and he passed away from a glioblastoma. I was actually the one that looked after him. I think, one of the best things about academia is the ability to sit in a group and just toss around ideas. And when here in Edmonton, some of you may know Finley McAllister, it was Me Too, Finley, and those two guys are world-class researchers. And it just was such an honor and a privilege to be able to do that up until the time that Me Too left us. And I think that was part of the other reason why I just wasn't feeling it anymore. But I certainly didn't want to stop the curiosity and innovation and potential for impact. And it was actually at a CIHR meeting where I met my co-partner, my major co-partner in the company, who was working as a research manager for another scientist. And we started talking, and he had some experience in starting companies, something which I had never thought about before. So let me go through what we do. And then I want to double back and talk about why we started the company and why, most importantly, is something you should really think of. And I'll preface this by saying you have no idea what opportunities are available to you in the entrepreneurial commercialization space. It is actually a completely parallel way of getting funded for your ideas. That's really the bottom line. So we have CIHR, and for some of you, there are other organizations and opportunities that fit, whether you are focusing on a specific disease or whether you qualify for things like NSERC or other things, depending on the type of research that you do. But there is, in fact, another parallel opportunity for funding that has significant amounts of funding that I think no one in the academic world really understands exists. And that's actually why I got interested when Pete, my colleague, my partner, my CEO, and I started talking. I realized that, in fact, I could get funded to do the exact same ideas I was writing grants for. The only catch was the feds, the funding body, which is the National Research Council, told me, look, you have to have a company. So go make a company. That's it. You have to have a company and you have to put some of your own money in. And then if you're willing to do that, it's a much more gratifying way of going. So let me go into it. So Millimeters Mercury, we started off as a device company, but after 3 years, I realized making devices in Canada is really a tough slog for a variety of reasons, which I don't really need to get into here. But the bottom line is, luckily for us, we had a very strong software team headed up by our CTO, Chief Technology Officer. So we had a lot of talent, really, I think, world-class talent. And that was shining through in the software that we were making to partner with the device that we were working on. And then when others took notice across the world of that software, that really made me think we really should be a software company. Now we focus on cardiometabolic health, and I think you'll understand the clinical bent to this. Oops, this slide is out of order. So why cardiometabolic diseases? I mean, I think many of you probably working in this space. Look, I don't have to tell you what a problem it is, number one or number two killer in most countries in the world, and just abysmal control rates when you look, whether you're looking in Canada or across the world for a variety of reasons. It's just lots of work to do in this space. So what are we focused on? When I chaired the Canadian hypertension guidelines through that 5-year span, one of the things that we worked on and released, and lots of people worked on this, was the notion, based on many decades and many studies, that out of office BP measurement, much better than in office. Okay. And so that started me thinking, well, look, the better metrics are really the patient facing data. And when you look at blood pressure, it's true, whether you want to follow people over time with home blood pressure series, which is what's recommended, most of the guidelines, it's much better than using like sporadic clinic measurements. But you could even extend that to diabetes. Well, what's the industry standard now? If you really want to understand what's going on, it's CGM, of course, right? If you look at an area like atrial fibrillation, well, what's the response to, when a patient says to me, hey, doc, my blood pressure monitor showed that signal where my heart rate is irregular. What do I do? And what do I end up doing? I mean, it's tough to get Holters here. Unfortunately, internists can't really order them that readily. I have a back door, but most can't. So then if you don't get a Holter, you end up doing episodic ECGs. Just not a very great way to diagnose or manage conditions unless you're taking advantage of patients entering great patient-facing data. And a big part of that is data that's collected over time, because that really tells the true tale of that condition. So the challenge that we're trying to tackle at Millimeters, along with many others, is this challenge of, we have these archaic sort of legacy software programs, EMRs. I'm not sure which one you guys are on. We're on Epic. EMRs that are focused were made to do billing, and now are sort of been perverted to do clinical care delivery. So really unwieldy and inflexible and not interoperable. And then to get patient-facing data like CGM or like blood pressure or weight or whatever it is, constantly reported by the patient, is tough to do. And so across the world, and we're actually a globally focused company more so than Canada, people just end up doing one-offs, episodic in the clinic or health screening, and that's what they use for decision making. And it's really, again, we think, and based on a lot of evidence, the wrong thing to do. So what are we specialized in trying to do? Well, we started off in blood pressure, but now we're expanding to some of these other indications shown on the screen. What we really want to do is be specialists at bringing patient-facing data to providers or researchers or payers. And that way people have a really good understanding of what that population and individual patient is doing and can make decisions in a much more informed manner. So here's one of our products. It's a remote patient monitoring, or in the United States, it's called self-measured blood pressure monitoring platform, because the biggest use case is for blood pressure. What does it do? I mean, it's a cloud-based platform where patients use either a smartphone or a tablet. They Bluetooth their readings in. We have many peripherals connected to the system. So many different devices work with it. It's multilingual. It's compatible with both Apple and Android products. And then really we specialize in making sense of the data, presenting it to providers in a way that makes sense and is guideline concordant. getting patients to enter it in a way that's guideline concordant. So this is where our academic knowledge shines through. And then interoperability, getting it into EMRs in a way that the providers want. Here's a second platform where we do ambulatory blood pressure monitoring. Really, it's all about, if you're not an expert in ABPM, the platform makes you one because it steps you through doing the test properly in an evidence-based way, including interpretation and EMR integration. So that gives you a flavor of what we do. As I say, we're expanding our platform to encompass more use cases like diabetes, Holter. We want to do some things in sleep. We think there's a lot we can do, and we're actually expanding in terms of our AI capabilities and the markets that we serve. So we started off in Canada. We got most of our initial traction in the US. Some of our traction is shown below. But really our biggest focus now is India, because India it's an interesting market. It's really predominantly a private system. The patients are well informed. The providers are extremely well informed. The care can be cutting edge, but the tools are not there to enable it. And so we want to be part of the solution. The nice thing about an India opportunity, it's a big opportunity for us to impact the health of many patients. And so this is something that has us really excited. It's not without its challenges, of course, but it's something that I really think, when I think about a patient in India having high readings in the office, not having access to ABPM, but then with our platform, they can, and they get the best test and they don't get put on medication because it's all white coat. When I think about an underserved patient in the inner city Chicago that is on our platform, bringing readings to their provider and finally getting the care for BP of 200 systolic, these are stories that happen all the time. And it's much better impact, I think, than I ever had doing my academic work. Because with my academic work, I tried to knowledge translate. Maybe that's on me. I didn't knowledge translate as well as I could have, but I just found that the stuff that I did, minus the guidelines, really wasn't taken up that much. And it took a long time for example, Alberta Health Services to recognize and realize what needs to be done despite many, many, many meetings. So here's the team. This is the last slide on the company. And really, great team, really fun, very analogous to putting together a team grant, working with a group of academics, just very much the same thing. Three of us, the top three, have a background in academia, and really we're focused on trying to do some great stuff and improve health. We have, I think, 14 employees, and so we're slowly growing, although we do want to try to increase the rate of growth over time. That depends on a few factors, but 6 years later, 3 years into our software pivot, we're still going strong, which is a bit surprising to me, but I think just a testament to, I would say, our academic skills and the sort of perseverance that we learn from academia. So let me flip this back in the last few slides and talk about why I think this is something you should consider. So I would say to you, for the example of my career, and of course it may be different for you, really much bigger impact on the ground at the level of the patient, the desired outcome with commercialization by far. I think we have 20,000 active users of our platform globally because we private labeled a platform, and we're doing things like making a platform for the American Medical Association, which they will launch next year. So I think the impact will just grow and grow if everything executes to plan. I would say like the biggest thing is control. Control, because you really don't have to answer to anyone. You get the funding, you have to execute. It's very much commercialization focused from the funder, so it's a little bit of a different mentality. They're not interested in papers. They're not interested in students trained, but they are interested in employees hired and revenue gained. And while those are different kinds of metrics, definitely, they're kind of similar metrics in a way. You just have your metrics that you're following along and need to try to execute on. So in many ways, it's not that different from focusing on academic work and trying to deliver on those metrics. Now, I would say to you, so how do you get funding? Well, there's an organization, an entity called IRAP, IRAP. I always forget what it stands for, but it's a branch of the National Research Council. So if you Google IRAP, Industrial Research Assistance Program or something, that's really the CIHR for commercialization in Canada. And then provincially, you probably have in Quebec, you probably have another entity, and I don't know what it is, but in Alberta, it's called Alberta Innovates. And Alberta Innovates does similar commercialization funding that to IRAP. IRAP funds more R&D for when you're first getting started, and AI, Alberta Innovates, funds more when you're trying to scale, when you have products. But at the end of the day, what do you have to do to get funded? Okay, so I was talking about how, you spend 100 to 200 hours typically over your summer writing your grant, and it's just painful. You're not seeing your family. They're wondering why you're working so hard. I mean, I'm sure you've all been through this kind of a story. Guess what I did to get my first 50K of funding from IRAP? Okay, I put on a nice suit. I made I don't know, I think I made a 10 slide pitch deck, but I only got through 5 slides because the guy had lost interest by the fifth slide. Like, he'd already made his decision. And I said, this is why a new blood pressure monitor needs to be built. Of course, we ended up pivoting from that 3 years later, but be that as it may, you had an idea, pitched the idea, and he said, okay, we'll fund you. Now, the catch is they'll give you about 50K in funding, but you have to match it. So you have to get together a group of people, or do it yourself if you want, and you have to form that company. So it is some out-of-pocket costs from yourself, or unless if you get investors. But I didn't have the mentality to want to get investors at the beginning, like investors outside of who would be working in the company, because I just didn't want to take people's money and then end up failing. That would have made me feel bad. Now I probably have a different mentality, but in any event, that's how you get started. So, and then really, I mean, you have to spend a lot of time on your idea. It has to be a solid idea, not only to get the funding, because just getting the funding, that's only the first step. I mean, there's a lot of work to deliver on what you think you can do. So, so that's how you get commercialization funding when you first start. And I will tell you, as a PhD researcher, or as a physician researcher, or a nurse, pharmacist, whatever your background is, you have instant credibility. You really do, because your competition are people with MBAs who may not have much experience, and maybe, I find that their ideas are just always slightly off. So they make certain assumptions that aren't really grounded in reality. Just like I was quite naive about certain things in the business world that, of course, would be second nature to them. And so you do have an advantage from the idea viewpoint, because you know your field and you know what needs to be done. So that's why, one reason why I think academics are ideally suited. Um, so the collaborative spirit, the diligence, the persistence, the drive, these are all qualities that you all possess. Otherwise, you wouldn't be in academia doing what you do. These are all qualities that translate, I would say they're the core qualities of successful entrepreneurs. The one thing that I have noticed, it's true, it's kind of a stereotype, but it is true. When you look at entrepreneurs from the MBA world, I mean, what is the thing that really makes them want to do what they do? I mean, I don't want to be, again, I don't want to sound like a jerk, but I think they'd probably admit it as well. It's really success, and success is measured by income, revenue, size of the company you built, exit. Um, that's not what drives academics. And so I think that's a good thing. I think it's a good thing because you end up spending more time thinking about the quality of the product and whether it actually fits in the market, whether it's usable, and whether you think it's going to help people. Whereas, I find some of my business colleagues, they're more interested in just get a product. Maybe it'll work, maybe it won't, but by the time we figure out it doesn't work, we'll have made a lot of money and moved on. And that's sort of not the kind of attitude that I can align myself with. But I mean, sure, they'll make money, but I think in the end, this is why I think more academics need to get into this space and get this funding, because I think we do better things with the money. And not that we don't shouldn't and can't work with MBAs. I think the best team has both, but I think an academic has a different viewpoint. I would also say your supervisory skills, because really what you end up having is a team of employees, and that is really essentially identical to running a lab, to running a dry lab, wet lab. I mean, I don't have experience running a wet lab, but from my time running a dry lab and having many students, really the same kind of thing. Pitching is the same, whether you're standing up doing an academic presentation, it's a little bit different, but not much. You still have to be able to present and knowledge translate. Okay, what are the things that are not so great? So number one, you have to come up with some funding, and some of that probably is going to be your personal money at the very beginning. So that's a barrier. That's a barrier for some people, for sure. I didn't have any business experience. I think that did hurt at times. We made some mistakes that if we had some experience, we wouldn't, but none of it was insurmountable. They were kind of like, oh, okay, lesson learned, let's move on. And there are ways, you can get advisors, you can bring to your team people with business experience. There's lots of people interested in working with academics, definitely. And so I could have done a better job sourcing partners at the beginning, but we learned in the end anyway. I think that the one thing that I would say, the mindset I had discussed already, but the one thing is, as I mentioned off the top, unfortunately, commercialization is not a great word in academic and scientific circles, even clinical circles. And it just tends to turn some people off. Some people respond really positively, but a lot of people, especially in Canada, I find not so happy about that angle. And I'm not really sure why, but I think they may have a misconception about what it involves, and maybe it's the sort of notion that it's all for profit and that's the only goal. But that's not how it is. It depends on who you are, what you're trying to do. I will say, though, in other countries, especially the US, so the US, they're very interested in what you're trying to do, and they're interested in it. They're interested in understanding it, because Americans are very focused on, is this a good idea? And then if it is, I think I want to see if maybe I should do it, or maybe I could do it better. And so you see that a lot. You see that from some European countries as well. And so, like, I do think, this is a little bit of an unfortunate situation that hopefully will change over time, because as I mentioned, for a variety of reasons, I really think academics need to get more involved. Lots of funding up for grabs. And I think it's better going to academics or academic business teams. Now, you can't get focused on the narrow, okay? You cannot get tunnel vision. Tunnel vision is maybe really useful when you are studying one small thing and producing many papers and solving a mystery that's very focal or localized, but it's not good in the business world. You have to have a broad perspective, and you have to be able to pivot, and you have to be able to take criticism and understand, okay, this is not a good fit, or these people don't like what you're doing, and this is why. And you have to really listen, try to understand what the message is, and try to improve your product and the way you're operating. If you can't do that, you're not going to be very effective in the business world. So there's, it's very interesting, the humility that you learn. um, it's actually, surprisingly quite a lot, in the commercialization world. But if you take it as constructive criticism to try to improve, then it does help. So then, just to finish off, oh man, I guess I can talk about myself for longer than 30 minutes. So just to finish off, what if you are interested? Then how do you do things? So I think I touched on it already. Spend a lot of time on your idea, bounce that idea off trusted people. The idea is the most important. Last thing you want is a weak idea. You do get money, you put some of your own money in, and the whole thing goes belly up, which happens all the time because people haven't thought through their idea. So you need a good idea that will generate, not only will do good things, but that will generate revenue. Then you need the seed money, and there's a variety of ways to get that. Then you can pitch and get your matching funding from IRAP to start. You have to really focus, just like when you're running a research program, you want the best students. You need to source and, as much as possible, get employees that are really the best of the best. That's going to have a huge impact on your ability to be successful. And then I see, there are a few academics here that have started startups in Edmonton, and some of them have come to me for advice. I would say that the more successful ones heed this advice at the bottom. Do not try to make a perfect product. That's going to kill you. I've seen people do that, and I think they're doomed to failure. You need to make the minimal viable product, get it in the market, get pilots, hopefully revenue generating, and then refine it. Refine it so that you make it what the end user wants. And this is not like I'm anything like Steve Jobs, but this is really was his motto: is build great products, figure out how we can make them better for the end user. And that really, I mean, there's no substitute for that advice. It's outstanding advice. And then I think this is another way of what I've basically said. When you get to the point where you have a product and are generating revenue, that's the point where you want to do a raise. And that's a whole other discussion. But again, it's just like getting subsequent funding for your line of research that you're doing. It's just in a different way. You're talking to different people, venture capitalists, rather than going back to CIHR or another funding body. And nothing, by the way, prevents you from going to some of the funding bodies you already go to. Some of them, like Heart and Stroke, disqualify you from getting holding funding for if you're part of a company. But you can also find colleagues who are not part of the company and team up with them. So there is very flexible, and it opens up a lot of potential possibilities. So this is the IRAP website. So I guess I was right, Industrial Research Assistance Program. And I already discussed this, so this will be recorded and you guys can look through it. But if you have any interest, I would highly recommend going to their website. And then this is the summary. So really, I think I'll end it there. And I hope this was helpful, and I'm certainly happy to take comments or answer any questions.
Can I jump in there, Ben?
Yeah,
First,
sure.
Raj, thank you for joining us. And I want to apologize. I think you have 15, 16 intent listeners, but we seem to be dying in numbers as we approach December. And we did have a retreat on Monday, so that might be part of it. But
yeah, no problem.
This is fantastic. I was a bit late because I was giving up money at CIHR, so the big bucks. So I have a couple of questions for you, and I'm sure others have a lot. One is that, I wonder if there is an element of phases of careers, because for those who don't know, I mean, Raj is an outstanding scholar, Canadian Hypertension Education Program, tons of grants, major publications in hypertension, obesity, diabetes. And you kind of would have had to, I mean, I think in your journey, you accumulated all of that experience. and then came to a kind of a decision point and then started a new adventure. So, you know, is that the journey, or do you see also, because I feel like you need to gain some academic knowledge, credibility, experience, or that could be helpful. But how do you see like a younger person, younger than us, starting, and how, you know, what would that look like?
Yeah, that's a great point. So not to insult us, Kabiri, but for us, you and I,
Yes.
yeah, it's not something we could have done at the beginning. No way.
No.
So I think when I started as an academic, I still didn't really, I mean, clinically, I had a good mastery of my field. Um, but academically, you know, the ins and outs of what questions were most compelling, um, you know, where would I go? What is the next step to answering that? I didn't really know that. It took me, well, I would say at least 3 years. I mean, I didn't write my first grant until 3 years, and I'll never forget that day because I was sitting in my office. I don't know what I was doing, and then Me Too walks in and he goes, "Hey, your 3-year review should be coming up." And I was like, "Oh yeah." And he's like, "So what have you done for grants?" And I was like, "Grants?" He's like, "Have you written a grant yet?" And I was going, "I've never written a grant." Me Too. And I mean, he almost went apoplectic, right? So that's how clued out I was at the very beginning. And I mean, you know, Me Too was a guy that sort of shaped my career because he kind of like lit a fire under me and said, "Okay, let's go. If you're going to be successful, we better get started here." Um, so I think no way would I be ready. But there are MBAs, MBA, is it MBA MD, or I think it's probably MBA MD and MBA PhD programs here in Edmonton. So I can't imagine they aren't
Mm-hmm.
there at McGill. And I would say, so I met one young, I mean, he's a fellow or a third year resident, core IM resident going into pulmonary. And he did that program, just a super intelligent guy, and has his MBA now. You know, is he ready out of the gates? Yeah, I think so. I mean, I think he'll need a couple years to really figure out the idea. That's why I bolded the idea. But I think he'll be ready because he has some of the background that I didn't. So it really depends. It really depends. If you don't have any formal business training, yes, it's probably after 5, maybe 10 years, something that you should think about getting into. But you do need some seasoning.
I have a question if I don't see any in the chat, but so first of all, that was, yeah, a really eye-opening presentation. Thank you for that. You highlighted some things that I didn't appreciate at first, but now that you mentioned them, it's like all the bureaucracy
Yeah.
in the academic world with respect to hiring, using the money that you fought for. Those are so true and resonate really well with me. And I don't want to come across as one of those people you described, like a Canadian academic who, once someone crosses the threshold to industry or the private sector, that we sort of view you as an enemy. I don't think that way, but I would like to hear your perspective on it a bit more, because I guess the guiding or motivating force for me is to improve health, like human health outcomes. Making money on some level doesn't factor in too much, but it's not black and white, as you alluded to. I mean, I need to get grants, I need to publish, I have, like, for promotion and so on. And so there's still some conflicts there. But on the commercial side, if I can describe it that way, I think the importance of making a profit is much more front and center. And so how do you, because I think part of what motivates you from the description of the things that you're commercializing is human health, improving human health outcomes. But so how do you balance the, it seems like a conflict. That doesn't mean that you shouldn't or couldn't do it, but just how do you juggle that?
Yeah, no, it's a great question. And I'll say, you know, Ben, when I first started, I was so naive, and I remember talking to the IRAP person to get that pitching session. And I said, hey, I was reading about IRAP funding. I want to apply for IRAP funding. And he's like, oh, doctor, yeah, that's great. We'll book a meeting and we'll hear your pitch. You need to do XYZ. What's your company name? And I was like, company? He's like, you can't pitch to IRAP as a personal individual or as a researcher or professor. You need a company, right? And I mean, the way he said it was sort of like, man, who am I talking to? Like, what kind of idiot is this? But that's when it really kind of struck home that, oh, geez, I mean, luckily Pete had done a couple companies. And so we kind of knew what we were doing, but I mean, it's a foreign concept. Okay. Now, here's how I would answer that question. I mean, 6 years in, I started drawing a salary from millimeters mercury for all the time, evenings and weekends I spent on it this year. And it's a fairly nominal salary. Why? Because all our revenues get pushed back to hiring and developing better products. So, and now on the flip side, I will also add, I mean, I'm lucky. Like, I'm a physician. I've worked now for almost 20 years. Um, I don't spend a lot of money. So financially, it's not really that important to me to have a big salary or be looking for a big exit and trying to sell this company. We're really in it to try to improve health, as you say. And so we have the luxury of doing that. Whereas a lot of entrepreneurs, I mean, they pour their life savings into a company and it's just all or nothing, right? And so it's a little bit of a different situation. But I would submit to you, if you're an academic and you're at an institution and you're doing stuff and you have a company, what a lot of academics do, you're getting a salary and you're getting paid from your clinical work or from your academic work, and perhaps there's an arrangement where some of the company's part owned by your institution or however that works. Then it becomes less of an issue of, okay, we're just trying to maximize revenue, and more of an issue of, okay, we need to make money because we need to pay these people and we need to grow this company. And so that's the attitude we always had. And so we went from 3 employees to 8 to 10, now to 14. And some of these are reasonably high paying jobs. And so we've done it by pushing all the revenue we make back into hiring and keeping and retaining these people. And they're great people. So it's kind of like a family you're responsible for. So the last thing you want to do is lose that revenue and have to lay people off, which I unfortunately have had to do on occasion. But overall, the trajectory's gone up. Now, in the end, I'm not going to lie. Like, so first of all, we're not in a situation where we're making scads of money. And I think we're, a fair ways away from that. And there's a lot that would have to happen for us to be a really successful company. There's a chance it may happen. And if it does, I can tell you probably at some point we will probably get bought out and it'll be great for the investors and shareholders. I'll probably plow that right back into a second company because I have the bug now and I see the power of this, and it's just a way more controllable way to do some good stuff. But I mean, it depends on your philosophy. That's really the bottom line. I think the way academia should get into entrepreneurial work is in a really concerted effort with your institution, maybe. I mean, our institution was rather disinterested. I mean, we asked them at the beginning, do you want shares? Do you do things like invest? They weren't at all interested. The only thing, there was some external vehicle, they called it Tech Edmonton. It's not around anymore. But those guys, they didn't really provide any value, but they would want to take a bunch of your equity. And so we just went it alone. But I think in 2022, things are a lot different. I would imagine at McGill, you have tech transfer and you have tech support. And so it's probably a lot different. And so you're coming in from a very different mindset as an academic when you're forming a company. And maybe you do it in a more protected fashion in partnership with your institution. That means your upside is capped or limited, but that's probably not why you're doing it anyway. So it's not really an issue.
So in a funny way, it's a bit like because what you just described, we all do. We just have smaller enterprises, right? So I have whatever 2 to 3 research assistants, and half an analyst and PhD students, and so that's the family that
Yeah.
we have to bring in. Our funding from CIHR and Heart and Stroke, and there's some days where you're not sleeping very well because, oh my God, what's going to happen. So it's sort of like you've taken that to just a kind of a different arena. Is that a sort of a fair
Absolutely,
analogy? Yeah.
Kabir. And I mean, I'm an example of someone that sort of got a little bit disillusioned and kind of switched. I'm still in academia, I'm still writing papers, presenting and publishing,
Mhm.
but to a much lesser extent than I used to. But there's no reason why you can't do both, right? If you wanted to, I would suggest, and the whole point of this talk, maybe it didn't come out, but the whole point of this talk is to say to you, investigate commercialization, because even if you continue on your academic path, this is another way you can bring in money. It's different. You have to do different things,
Mhm.
but it's still federal and provincial, if there's a Quebec organization, money aimed at improving health. It's
Mm.
just a different way to do things. It's actually, I would say, if you ever get funded by a university hospital foundation, that's, or a health foundation, like what's the one for diabetes, the Lawson,
Yeah, I have.
that's
Yeah.
actually an intermediary, right? So
Right.
there's like federal grant funding like CIHR, there's that funding, which a lot of it is from donations, right?
Right.
I mean, of course, it's controlled. It's not something that you own and operate. And then I would say the enterprise, the commercialization is just a little bit on the spectrum, but it's another way to have people working on what you want to work on. And if you look at it that way, I think it's not something you should um, discount until you look into it and see if it's suitable for you.
Mm. I think it sounds very, I mean, because it's kind of the quote unquote purity of motivations. I think that's what, in the questions around conflict of interest, because we all know as researchers, academics, MDs, in our cases, you could kind of sell anything to anyone, right? You could sell something bogus, and there are people, and we know of people who would do that. So I think that's where but it probably isn't the commercialization in and of itself. I mean, there are people who are just interested in writing papers and becoming famous. It's not
Yeah.
necessarily a pure health for people kind of a motivation. So yeah, it's an interesting
Yeah, I was gonna say, Kabir, I
yeah,
mean, look at the academics that have done bad stuff. And,
yeah, yeah,
I mean, it transcends whether it's commercialization or academia, it's more about the individual
yeah.
than anything else.
And there's a lot of people here who have developed apps of late, and there have been some efforts for commercialization with, I think, some variable degrees of success. I haven't tried to jump into that, but there have been. Do you have thoughts or comments on that? Because that seems to be the standard product that, academics in our
Yeah,
community are
yeah.
coming in. Yeah.
I mean, I think it's a bit late now, Kabir. I mean, it sort of maybe depends on what is the focus and what's available out there. Maybe if it's an innovative product for that fits a certain need in a certain niche, then it could resonate and grow.
Mhm.
But there are, as you know, tens of thousands of
Yeah.
apps now.
Hmm.
And really, when we started this, it was more about a platform of
Mm.
bringing patient-facing data to providers. It's not the best, it's not the most compelling area of business to operate in, because you're dealing with physicians who can be difficult to deal with and difficult to meet with, and they're busy people, so that is a challenge. But I do think that it really what I think the app story is maybe played out in most areas, but it's really more about like digital health. There are ways to improve care, I think, but you
Hmm.
have to think very carefully about your field and what you can do in it. So it may involve an app, it may even involve existing apps, but it may involve platforms, cloud. Cloud was the big innovation that allowed us to do what we do. We
Mm.
can deploy our platforms anywhere in the world within 2 hours because of
Mhm.
the cloud,
Mhm.
because
Mhm.
of Amazon Web Services, because of Microsoft Azure. If the cloud wasn't out there, we wouldn't have a product.
Because their
Uh,
data can be stored in their
yeah,
jurisdiction.
and
Is that
it's
the notion? Yeah,
absolutely,
yeah,
and it's
yeah,
all HIPAA, PIPA, PIPEDA, like it's all
right.
secure. It's like the securest, most lockdown systems in the world. I mean, who's gonna hack Amazon, right? I mean, they have the best security out there. Your institution's much more likely, like we always kind of smile when people say, oh, our ABPM programs on our servers at our hospital. And, you're talking about using the cloud, but we can't use the cloud. But I mean, what's more secure than Amazon? It's way more secure than your institutional hard drive. So like,
Mm,
that's kind of the hilarious sort of side comment there. So I
mm,
think, what you have to do is spend a lot of time on your idea. You have to understand, okay, what's out there? What are the tools that are going to enable us to be successful? For us, it was the cloud. Um, and then you have to understand, where are you trying to reach? For us, it's India, it's the Middle East, it's Africa.
mm,
We want to bring tech to people that will never have a chance to get tech otherwise. And with our pricing, it's so low, it actually becomes quite feasible.
mhm,
Whereas, if you take a company that does the same thing we do, but in the commercially insured market in the US, I mean, they're charging, I don't know, 20, 30 times what we charge. That's
mm,
never going to fly in Africa, India, or the Middle East or South Asia Pacific.
mm.
So that's why we feel good about what we do, and we think we have a chance to make an impact. But it remains to be seen. Execution is everything, and competition is there. So we'll see how it goes.
Fantastic.
All right. Well, I think it's top of the hour. We'll stop there, and thanks once again for this really provocative talk.
I think
All
you're
right,
going to get
take
a
care,
lot of
everyone.
views, Raj. We'll tell you
Yeah.
Yeah.
after.
All
Thank
right. Yeah.
you.
Bye
Bye.
bye.
Okay, well,